cases you needed or the patient needed self.
Okay, we have done nearly 37 to 38 cases in last 2 years in our institute, and roughly our success rate is around 85%, 85 to 90%, and in very few cases in which buccal mucosa grafting is done. So in very few cases, any ancillary procedure has to be done. When we do the follow-up cystoscopy, usually sometimes it's very difficult to recognize the grafted mucosa. It assumes the shape of the normal urethra.
There are some cases in our area or hopeless in that from the external meters still inside four of the multiple infections or disease. In such cases, what can
It depends on which part of the urethra is mobilized and the underlying etiology as well. Like if in the lichen planus, of course, then you have to move the further area, and then there are different techniques. If only the pendular part of the urethra, then obviously the technique could be different. We can deglove and then we can manage from the penile area as well. But the situation like this is a similar case which is nearly a hopeless. Although some part of lumen was there, that's why he was living his life with this till the time he went to retention because of that small stone. But this sort of ureterogram is of course a nightmare, and it's a difficult situation. You must have noted that I've applied a stay suture on the top of the graft and then make it sure to put the graft at the last part of the structure, even in the distal as well as on the proximally. So using the suprapubic port, we can just pull the graft's tip all the way up to the bladder neck. So we have found very good result of that. So I know 100% results cannot be there. But as far as this technique is concerned, I think little modification of this Kulkarni technique will give very good result for the cases which are nearly hopeless.
Shivandani, I'm Dr. Ramesh from the hospital. Very good presentation. My question is that just I want to understand the incision you made over the urethra. Either it's the dorsal side of the urethra or you just applied incision on the lateral side of the urethra. Because you place the graft in longitudinal fashion and you stitched on the both sides.
Okay. It was actually 12 minutes time, so I skipped a lot of stuff. Initially, we have opened it from the midline after opening the subcutaneous tissue and fascia. Then